Hi, I'm Allison. I'm the pharmacy intern here. I just want to counsel you and your family on the Narcan that we are sending you home with. It looks like you're on hydromorphone and the methadone, which are both opioids. And something that we want to be cautious of using opioids is the potential of an overdose. So the Narcan is an opioid antagonist, which means that it reverses the effects of the opioids temporarily in the case of overdose. So family, you should know how to use it in the case that she does experience an overdose. How you can identify this overdose is that she will be extremely sleepy, unarousable, and they should have shallow breathing. So the steps that you want to take is you want to shout the person's name, try to wake them up by shaking them. You could rub the sternum really hard right here. This is very painful so that if they don't have an overdose, they should be waking up. If they do not wake up, then that's when you want to give the Narcan. So the Narcan is a nasal spray, so it should only be administered in the nose. Do not prime or test the nasal spray because it only contains 2 doses. So you want to lay her down on her back and remove the spray from the box. And then you want to tilt her head back and support the back of the neck using your hand. And with the other hand, with the spray, you want to insert the nozzle of the spray into the nostril into one nostril until the fingers on the spray touch the nose. And then you want to press the plunger firmly and then remove after the dose is administered. This is a critical part. You want to move her onto the side. And this is called the recovery position. So this is where her hand is underneath her head so that it supports it, and then you position the knee forward so that it prevents the body from rolling onto the stomach. And this keeps the airway cleared and prevents the patient from choking. You want to call 911 right away to get emergency medical help after giving the first dose of Narcan. And if she doesn't respond in 2 to 3 minutes, then you can administer another dose into the other nostril. And you just want to be with the patient and monitor her until help arrives. So Narcan is pretty well tolerated. There are some symptoms called opioid withdrawal symptoms because we are reversing the effects of opioid. So the withdrawal symptoms include body aches, diarrhea, increased heart rate, fever, runny nose, restlessness, shivering, irritability, but our main concern right now is to reverse this overdose and get the patient to the hospital. So families should know where you keep the Narcan at home so that they are able to locate it in emergencies. And we also want to store the Narcan in room temperature and keep it in the box until use. So some preventative measures we can use so that we prevent any overdose is that you want to take the medications as prescribed. So don't take more than that, because if you take abnormally high medications, that's what causes high levels of medication. That's what can cause an overdose. And you also want to keep the medication vials in a safe place so that other family members or children cannot access these medications on accident. So keep it away, stored, and only take it as prescribed. If you have any questions, you can always reach out to me. You can give me a call and I will be happy to answer for you.